Hey guys, welcome back to Second Chance Transplant Living. So today we're going to talk about what everybody wants to know is how can I travel and how soon I can travel and what my safety precautions are. So we're going to get into it. So today, like I said, we're talking about travel. And when I talked to my transplant team before surgery, they were always telling me, you're going to international travel, you're going to at least wait a year. We want, your immune system to kind of be um, up a little bit. It's never going to be normal, but we want you to be, your body to kind of adjust. And so, we want you to wait a year. So I do have something booked in September of this year. I my 1 year anniversary was last week, so I booked a cruise in September, and I'm excited about that. That's something to look forward to. So that's you know um, something that I have now that along my journey that I'm working towards to be able to that I have something in my mind that I'm preparing to look forward to, even though it may be daunting at sometimes thinking about it and how to stay safe with it. And that's, another thing, another topic. What do we pack when we are traveling? Of course, you're going to pack your masks, things like that, hand sanitizers. Got to pack all your medicines. You want to pack extra medicines. Of course, put some in two different places, in case that are you going to travel on an airline? Are you going to travel just, are you driving to wherever you're going? Um, those things come into play too. So pack extra medicines and put them in separate places. That way, if you lose luggage or something on a plane, hopefully you're not going to lose it all and have to have some kind of emergency situation where you need your meds and can't get them. So be sure to pack extra and, be sure to take all your safety precautions and pack, your sunscreens, if you're going to a beach or area or anything, even if you're going to be out in the sun, even if it's cooler, because, with our anti-rejection medicines, we are prone more now to skin cancer than ever. So, you need to make sure that you pack hats, long sleeve shirts. You can pack the dry fit long sleeves, and those will be cooler. And that way, if it rains and you get soaked, they dry real quick. And they also have a USP or a UFPF in it as well. Usually they're a 30 or 40, um, so that your tanning or your sunscreens, you can use a little lighter sunscreen. Um, because you also have that sunscreen clothing on as well. Now, when I had my transplant, I was in the hospital from February 4th until the 10th. And then at that time, I went to a hotel and I stayed there for 10 days. And my best friend, they were actually taking their um, vacation and they decided to come and help me. So that was really nice. So, they wanted to go, but he had a condo booked at Edisto Beach. So the day that I got discharged from the hotel, I cleared it with my doctor that I could go. But I was to, of course, cover up, use a hat if I went outside, and just stay away from people, which that did not really seem to be a problem considering that it was February. Granted, it was South Carolina, so it was a little warmer, but it was February. So it wasn't going to be like a ton of people. So I actually got to go. Um, about 3.5 weeks after my surgery, I was able to travel and go to a beach location for a week, and got to visit with friends that came down to help me out. And, most of the time I actually stayed in because I did not want to dampen their vacation. I was well enough to kind of take care of myself. So, I let them do what they needed to do. But at least I was able to get out and socialize. I understand every case is different. So not everybody or their teams are going to be okay with that, depending on how your body's reacting to your transplant, because everybody reacts differently. That's just my situation and how, the team dealt with me on it. Now, they were firm when I told them I wanted to travel internationally. They said, yeah, you're waiting a year. And, I'm still, um, even though my year was February 4th, I'm still fighting with a little bit of ascites. Um, so we're tweaking that now to get to where it's optimal, to where I can have that final surgery for the for my hernia, and then we're going to go into. I'm ready to travel, and I'm ready to enjoy the summer and be safe about it, but go out and be able to go to the lake or and enjoy some fishing. If I remember, when you do that, wear gloves, that kind of thing. Any kind of fins or anything like that can prick you and give you an infection. Um, be cautious with those kinds of things. I mean, that's that stuff I enjoy doing, but it's also stuff that I have to be leery in doing because, that kind of stuff, it just did not phase me to even think about, you know, if a fish sticks me. So what? Now that's something you have to worry about. But in all, guys, yes, we can travel. Just make sure that you are. Again, that's up to your team, what your timeline is, that kind of thing, and the extent of travel that you can do. But it is something to look forward to. If you're here pre-transplant looking for answers, welcome. Share with other people that are going through this, um, guys, and also advocate. I'm very grateful for my donor. Um, I don't know much about them, but I'm very grateful that I got this second chance, and hopefully, advocate for um, everyone out there to be a donor, because it is truly a blessing. And I know that sometimes this gets a bad rap because families, when a loved one passes away, um, that they some perceive the teams that have to harvest as sharks, that kind of thing. So I know it gets a bad rap. Um, Pray for the technologies to advance to where um, you know we can we can get caught up, kind of, that we don't need to go that route at some point in this life. Hopefully, that technology at some point will catch up to where that the tissues and stuff and organs can be produced, to where maybe we don't have to rely on organ donation as much. But until then, guys, we really need to advocate for it. God bless, and we'll see you next time.